welcome to episode 203 of the Daniel Yoris podcast with today's guest, Dr. Sam Scott. Let's go. Welcome back to the podcast, everybody. Joined here today by Sam Scott. Sam, thank you very much for joining me here and taking the time. I appreciate it.
Thank you for having me.
We just found out that we both spent some time at the same university, which is crazy because pretty small world. I guess York University is a good university, but it's no name brand, Harvard, Oxford, or something like that. So small world that we spent some time at the same place there.
Yeah, absolutely. But I think it makes sense to some degree just because of the focus that they have on like exercise science and physiology, and also the history around diabetes and physiology that Toronto has as well.
For sure. This may be incorrect now, but when I started there, I'm pretty sure York University actually had the biggest first year undergraduate kinesiology program in North America. There was 1,000 students in first year. Then there was, a drop off after a bit after every year, but pretty big kinesiology program. So you're right that it does line up when you put two and two together, but yeah, small world. Anyway, Sam, can you please introduce yourself, let people know who you are and what it is that you do?
Yeah, sure. So my name is Sam Scott. I'm an exercise physiologist. I'm currently co-founder and CEO of a startup called Enhanced. What we're doing is aiming to help everybody who's living with diabetes to exercise in a more actionable and an easy way. My background, as I say, is in exercise physiology, did a PhD in the UK, which was focused a lot around how different intensities of exercise impact blood glucose concentration if you live with diabetes. And I was also looking as well at ways to do remote exercise prescription programs, both in type 1 and type 2 diabetes. After that, I did postdocs in Canada. That's why I was in York, focusing on that entirely. And since then, I've had experience working with professional sports and type 1 diabetes, in particular cycling. And then I now live in Switzerland, where I've been working for the last kind of 5 years or so. Wonderful.
And where does this interest in diabetes and exercise, why did you choose that?
So I've always been interested in physiology, science in general. The specific interest around diabetes came during my PhD. So to kind of take a step back and look at where the overview of my PhD was kind of around helping people to get into exercise. And one half of it was around muscle physiology, really going in detail of what adaptations take place at the muscular level. So doing a lot of muscle biopsy studies, using various microscopy techniques to investigate what is happening at a cellular level when you do exercise training. But the other part was very much focused around type 1 diabetes and how to safely exercise. And the real passion, I would say, for diabetes and exercise in particular grew during this period. And it developed really from getting to know a lot of people who live with the condition and having a small insight into how complex and difficult it can be and often is for people to do any level of exercise. So it's important to say as well, I don't live with diabetes myself, but I have a lot of friends who live with diabetes, and this is the real motivation. It's grown from kind of a passion to try and help people who I've met.
Makes a lot of sense. Diabetes, or type 1 diabetes, which we'll talk about the differences in a second probably, but one of those things that you can't really control. It's not curable unless you have some cutting edge, something that you want to share with us today. But it is what it is. And you have to, for lack of a nicer phrase, find ways to deal with it in your life. It's not something that you're just going to like take a pill and fix. And it's not your fault that you have it, but you have to find ways to live your life, and you can still be athletic and successful. And there are plenty of successful athletes who are type 1 diabetics, but obviously lots of different considerations that they need to be aware of in order to continue to train and excel in sport. So given that, and before we get too far away from it, can you very briefly explain the difference between type 1 diabetes and type 2 diabetes?
Yeah, absolutely. So yeah, there's different types of diabetes. The most common are type 1 and type 2 diabetes. Type 1 diabetes affects around 9 million people worldwide. It's an autoimmune condition. And for some reason, which is not completely understood, the body's immune system attacks the beta cells in the pancreas. So these are the cells that produce insulin. This causes a very rapid destruction of these cells, meaning that your pancreas no longer produces this hormone. And as a consequence, you're no longer able to manage blood glucose levels as you should to maintain kind of normal blood glucose levels. This results in a situation where you're relying on constant monitoring and administering insulin from either a pump or injections every single day. The other type, the most common type, is type 2 diabetes. This affects close to 600 million people worldwide at the moment. It's the most common type of diabetes. This is a much more chronic condition that develops over time. It's often associated with lifestyle factors, so things like sedentary behavior, inactivity, also nutritional factors as well come into play. Basically what happens is here your body stops responding so well to the glucose. Your body experiences higher blood glucose levels than normal. As a consequence, starts producing more and more insulin to compensate for this, to kind of bring the glucose levels down. Eventually your body can no longer kind of cope with this and stops being able to produce its own insulin. And at that point, you would then need to administer insulin. So it's a chronic condition. You do have other types, including gestational, for example, but these affect lower proportions of people.
Right. And they're only, they're more short-lived. It'll be happening during the pregnancy period, and then kind of it's gone after you give birth.
So gestational diabetes, it's something that develops during pregnancy. It tends to go at the end of pregnancy, but it's a problem because it can put the mother and the baby kind of at a more increased risk of developing complications or type 2 diabetes themselves later on.
Of course. Let's focus in on type 1 and type 2 again, the most common, prevalent, and the most widely applicable. Probably everyone knows someone who's affected by this, at least in North America. I'm not sure, maybe the numbers are a little bit different in Europe, but probably for sure in North America, especially the US. So how does exercise affect type 1 diabetes, and why is it such a difficult thing to manage when you're type 1 diabetic?
So maybe the best way to kind of start is to go through what should happen in a situation where your body is able to kind of self-regulate blood glucose itself. So your body is really good if you're not living with diabetes in maintaining normal blood glucose. It does this through a balance of different hormones. So when blood glucose starts to rise, insulin is released, which causes the glucose to be taken up by the muscles. blood glucose level kind of drops back into normal levels. On the other hand, if blood glucose is going on the lower side, there's other hormones that can be released, such as glucagon, which you would call like the antagonistic hormone, which acts on the liver to release glucose to raise it. What your body's trying to do is maintain this state of homeostasis. The reason being is that you want to avoid high blood glucose and low blood glucose. In type 1 diabetes, as I mentioned, you stop producing that hormone insulin, so you're no longer able to self-manage blood glucose, like from a physiological level. And you basically have to replicate this through monitoring what your blood glucose is and then responding either through insulin administration or nutrition. Like if your blood glucose is low, you would consume carbohydrates. With exercise, this adds in complexities. On a simple level, exercise often acts similarly to insulin in that muscle contractions have an effect in terms of the transportation of glucose into the muscles. So insulin has an effect because what it does is it acts on receptors at the muscle level called glucose transporters, so GLUT4. Similarly, when you do exercise or you have muscle contractions, there are different pathways there that cause this uptake of glucose into the muscle. So therefore, when you start exercising, contractions increase, glucose kind of levels decrease because they're taken up into the muscle. This is where the increased risk of low blood glucose happens. Because you are reliant on giving insulin exogenously, so by injection or by pump, you're having to manage this yourself. This is kind of a very sort of basic overview of it. It becomes more complex when you look at additional factors around what actually happens during exercise under different situations. So the effect that I just described then, whereby blood glucose will tend to drop during exercise, doesn't always happen. If you do very high intensity exercise, for example, what tends to happen there is that you'll have a big surge of catecholamines, different hormones such as adrenaline, noradrenaline, which cause your liver to release glucose itself. So actually what you can see is a big spike. So exercise is difficult because you're adding in all of these different factors that can influence blood glucose in terms of lowering or rising, and you've got to take that into account. In addition, it's not so simple as that. You have other factors to consider, such as weather, the temperature, other stress factors, duration of the exercise, what you've previously eaten, that kind of thing. So that's why it's such a complex situation, and this is what people living with type 1 diabetes have to manage on a daily basis.
That is an absolute ton of things, and it like speaks to how intelligent, I don't know if that's the correct word, but intelligent our bodies are to be able to, in a quote unquote normal state, to be able to just like handle all of these in addition to all of the other things that our body is processing. It's not just about insulin and muscle contractions. It's about a lot of, there's millions of things happening all at once and your body just like does it. And so for a person to consciously be able to do that, as you're describing that, the thing that I can think of that maybe is most, easiest to connect for most people is like, imagine you had to remember to breathe every single time. Like it's probably maybe not that extreme, but it's something like that. It's just a base function that your body should be doing under normal circumstances, and it's not. And so you have to take steps and measures to be able to handle that and do the job that your body should be doing normally, which is a lot.
Yeah, absolutely. I mean, it's something that when you don't live with type 1 diabetes, you're able to take completely for granted. There's estimations that people with type 1 have to make an additional 200 decisions every single day. It's exactly as you say, around the nutrition, about the exercise that you want to do, insulin, dosing, management, all of these things come into play. It makes life very complex.
Complex, but certainly possible, right? There are a number of professional athletes that we know of who are type 1 diabetics. And so it's not to say that like it's impossible. You can still play sport and excel in sport and various types of sports, endurance sports and power sports and everything in between, just more difficult. So how do you actually go about, or how does one actually go about managing themselves if they're in this situation?
Well, this is a big question. It will vary obviously from person to person. It is a big question to answer. The first thing will be kind of understanding, it depends if you're newly diagnosed or whether you've been living with diabetes for quite a number of years, but let's assume that you're just newly diagnosed, and bearing in mind, like, this is very oversimplified, what I'm going to say. The first thing that you'll need to kind of do is adapt to a new way of living, in that there will be new concepts to take on board, such as blood glucose monitoring. You'll have to start regularly checking your blood glucose, either through regular kind of finger pricks, or if you're able to get access to continuous glucose monitor technology, which a lot of people are nowadays, and then understanding what those numbers mean, what is normal, what is safe. When I say normal, I mean like kind of what ranges you're aiming for to avoid hypo and hyperglycemia, so dangerously low and dangerously high blood glucose levels. You will also kind of have to get familiar with the impact of different types of foods on blood glucose, and different concepts that start getting introduced, like carb counting. So being able to sort of estimate the amount of carbohydrates and the type of carbohydrates that you're eating, and the impact that this tends to have on your blood glucose. And then the other thing is around insulin dosing. So you will be, again, very simplistic overview, but you will have to talk very closely with your healthcare team to decide the type of insulin treatment that you'll go on to. There's different types of insulins. There's also different ways of administering it. So you can use injections, which involves basically taking numerous injections, where you're looking to mimic as closely as possible the amount of insulin that's required from your body to maintain those normal blood glucose levels. Or you might use a pump. The pump is basically a device that drip feeds small amounts of insulin continuously through the day, and you can kind of alter the amount of insulin that's being administered manually through the device. And then the other way is more and more people are having access to closed loop technology. What this means is that the continuous glucose monitor that I mentioned is able to kind of speak with the pump, and there's an algorithm which automatically adjusts the amount of insulin that's being administered, and this reduces a lot of the input, the manual input, and the decision making that's required on the part of the person living with it. So there's all of these different concepts. Then it will just be kind of experience and building up additional experience, building up additional knowledge of how your body responds to things. As I say, I don't live with type 1 diabetes, so it's something which you have a lot of additional kind of decisions and choices to take on board, a lot of monitoring, learning, and then you'll have new things that you'll have to take into account. So how you respond to stress, for example, how you respond to exercise, but incorporating and including exercise within your life, in my opinion, and also from a lot of people that I speak to, is very important, both for maintaining kind of healthy life, and also a lot of people say that their glucose management is kind of easier or better if they're maintaining their physical activity, if they live with type 1.
Interesting. That's interesting to hear, because it sounds like for someone who is living with type 1 diabetes, that exercise presents this whole new world of problems for them. Like, they're already dealing with the condition enough, and then presenting like a more extreme condition of exercise just adds a whole additional layers of issues. I can recall my younger brother, one of my younger brothers, he had a teammate on a soccer team who had type 1 diabetes. And I remember, I'm a few years older than him, but I remember this kid he would have like candies and stuff in his bag, and he didn't have a continuous glucose monitor, and I'm pretty sure he didn't have an insulin pump. This was more than 10 years ago now, but I remember he seemed as a kid like very in tune with his body, and he just kind of knew like when he needed to run to the side and grab a handful of candy and take it down, and then he would be like okay. And I never saw him have any attacks or pass out or have any like negative experiences while playing, and he would seem to be able to kind of just like handle it intuitively, which probably is it's definitely not the place that you would start off with if you're newly diagnosed. Like, you want to have that data and then be able to eventually probably make some intuitive decisions with that. But again, exercise presenting this whole new world of potential complications. So in addition to just normal conditions, generic benefits of exercise on physical and mental health and all the things in between, how does it actually help someone manage their condition of type 1 diabetes, even though it's presenting some other issues? Like, how does that actually work?
Mm-hmm. Yeah, I mean, and just to kind of go through some of the things you said there. So, like, I mean, upon diagnosis, oftentimes people do stop exercising. Like, if they were active before the diagnosis, they stop because there's all of these different factors to take on board. It's a very overwhelming diagnosis to kind of get used to all of these new concepts, as I say. And in addition to that, what you quite often find is a lot of like diabetes doctors and healthcare professionals do not really have so much resources to assist around exercise specifically. So exercise and physical activities tends to be put to one side, and there's sort of the assumption of let's introduce it later. I mean, the example that you gave there before, I can assure it's not like intuitive. It would have been so much work that this person has put in place behind the scenes. And right. This is the other thing is a lot of that is likely built up experience that they've had to do the work themselves, because accessing the information, accessing kind of a network to support is difficult to kind of get to incorporate. So that person's done really great to be able to incorporate that. And this is something that we're working towards, helping people more easily find the resources. We can kind of go into that later, but in terms of why it's important and the impact, one thing is that, as I said before, the physical activity is having an impact on your blood glucose. And what it's essentially doing is altering the amount of insulin that you would need as well. So by having physical activity incorporated, you're not needing as much insulin that you need to administer to kind of reduce the higher blood glucose. You're able to lower your insulin dosing, and it's just very important from different levels, from social aspects, from kind of just the regular reasons that everybody else wants to be active, the cardiovascular aspects, weight management, psychological health, kind of the team building, etc. So, yeah,
makes a lot of sense. Now, this may seem like a silly question, but when you were working with the cycling team and cyclists, they're all individual athletes, and so I assume that they had slightly different individual approaches to managing their conditions. But what were some of the common themes of things that they did like during training, during exercise to help them get through? I'm sure, again, different dosages of things and different, but I gotta imagine there were some common themes throughout them.
Yeah. So I've worked with different professional athletes with type 1, but spent a lot of time specifically with cycling. The common themes that you would see is that, again, it's kind of a very individual condition, in that each of the athletes has to work with their own healthcare provider. They have to figure out their own situation. There's not a one-size-fits-all kind of solution for every scenario. So this includes deciding whether they're using a pen or a pump, so the type of insulin administration. So starting off with that, what I tended to see a few years back was that the majority of people were using pens. The reason seemed to be because it was more flexible, in the fact that it was more kind of that they could not have something attached to themselves in the way of a pump, which a lot of them had said that they were worried about an experience of a crash on the bike or something, where you have something attached to yourself. You then have the risk of the pump breaking or failing that you have to replace. Another thing is just finding something that works and sticking with it, not changing anything after you've found that situation. However, when I was working with younger athletes moving forward, you tend to see more and more using pumps and more using closed loop systems. This could be either because they're having access to the technology through their healthcare system, or it could be because they're in a phase where they're experimenting more and they're more open to that, rather than a more senior professional wanting to sort of decide on something and stick with it. Other athletes that I've worked with are competing in not combat sports, or combat sports, or contact sports such as rugby, football, that kind of thing. There it can be easier to use pens because you don't have something attached to yourself. Again, you don't have something that can be ripped off. The other thing that's interesting as well is that if you talk about cycling, is on the nutrition and training side. So you have to be fitting in training and fueling to compete at a professional level. So the fueling is really around meeting the demands of your sport. So making sure that you've got enough carbohydrates to fuel specific training sessions, making sure that you're adapting over the course of the training season, depending on where you are, depending on your travel, depending on the type of race that you're going into. also taking into account weight management. And this includes feeding during events. So another aspect here, which doesn't really apply to kind of regular people doing regular levels of sport, is the amount of carbohydrates that you would want to consume during races as well, and the degree to which contraction-based glucose uptake is able to cover that, and the amount of insulin that you need to take while you're on the bike as well is interesting. So I kind of threw a lot out there, but basic take homes is that it's very individual. Still, unfortunately, there's not like one size fits all. It's definitely possible. It's definitely possible to do all of these things. And you need to kind of really adapt nutrition and training around demands of the sport and fit the diabetes management around that as well.
So to kind of sum that up and to try and make sense of it again in my own head, in the simplest way, the blanket kind of recommendation, if you are newly diagnosed as a type 1 diabetic and want to engage in exercise, which you should, is that you should, like, the number one thing is you need to take things slowly and find some way to monitor yourself and your condition objectively, and then kind of just like pair that with the things that you're doing. And then notice, if I have a bowl of oatmeal before training, how does my body respond? If I have eggs before training, how does my body respond? If I have fruit, in the middle of my training, how does that affect me? And kind of like, it sounds very unscientific, but like guess and check and just continue to monitor and find the approach that works for you. And then once you find it, just stick with it.
Yeah, unfortunately, there is a bit of kind of that trial and error, and it won't be perfect every time, and that's the process that needs to go through. But it can be sped up a little bit by finding other people who've gone through a similar situation and trying to learn from that, try and take information about what works for other people and then trying to apply it to yourself. And I think it's also important to see examples of other people who are keeping active, even competing, or just continuing with a level of physical activity that's normal for them, because it doesn't have to stop you. It's just about readapting and then finding a way to incorporate it.
Right. Now, last thing on this, then we'll kind of switch gears into type 2 diabetes, but it would still be some sort of individual approach. But if you are not a high-level athlete where the level of training intensity is, of course, much lower as like a general population, regular person who just wants to be fit and healthy, all these same considerations with exercise still apply, probably just to less extreme because there's less intensity. That's fair to say?
Yeah, I mean, ultimately, the most...
On average, or it'll be different for each person, yeah.
Yeah, I mean, the most important thing is the safety aspect, that in terms of... it is a very, very difficult condition. It's something where you do not get a day off from this, all of those decisions. And it's really about understanding those things so that you're able to kind of live a normal, healthy life and managing those things. Just because you don't compete in sport at a high level, many people in their work situations, you have stressful meetings, or you have exams if you're at school or university, or you have other emotional things that happen, or you have events that completely come out of nowhere that have to be managed, travel abroad, adapting to new situations like that. So it's very difficult for everyone, even if they're not competing.
Absolutely. Not something that I am envious of in any way. So type 2 diabetes, what are the different considerations in comparison to type 1 diabetes in regards to exercise?
So in terms of exercise, it will really depend where you are in terms of your health, status, any additional comorbidities. By that, I mean, if you have any problems with your heart, if you're on any other medications that put you at risk while you're exercising, if you have any joint problems. Reason being is that a lot of people who have type 2 diabetes are a bit older, 40s, 50s, 60s, plus. So starting exercise, if you weren't exercising before, will really kind of need a sort of evaluation of where you are with that, speaking with your doctor around what are the risks for you starting, in terms of if you haven't been active for many years, just rushing into something could be risky. Taking into account whatever medications you're on, and then the goals that you have as well around this. So if your goal is to increase physical activity to stay healthy or lose a bit of weight, or like on the social side to kind of make friends or join different sports clubs, it really depends on where you're at. So you have to kind of take many more things into consideration.
Is there as much monitoring of yourself, like intra-exercise, as would be required as a type 1 diabetic?
Okay, so yeah, you mean in terms of like blood glucose management?
Yeah.
Yeah, no, not as much as type 1 diabetes. With type 1 diabetes, and this is like really broadly speaking, but with type 1 diabetes, you're needing to really manage the risk of hypoglycemia. With type 2 diabetes, that risk is lower. Some people don't have access to continuous glucose monitors. It's not needed because their body might produce enough insulin still, or a small amount of insulin. It's something to be aware of. There are some medications that might increase the risk of hypoglycemia that you might be taking if you have type 2 diabetes, but it's not so much of this like constant monitoring that's needed.
So more of the considerations are about just being generally careful and cautious with starting an exercise program, especially if it's not something that you've been doing. If you haven't exercised in 20 years since high school, and now you've got type 2 diabetes and you want to like start exercising again, and maybe there's a comorbidity, maybe there's not, and you've likely gained some weight since then, and maybe your knee doesn't, hurts kind of a little bit. Like, these are the considerations, but these are not really different than the considerations for anyone who's starting an exercise program, whether you have type 2 diabetes or not. If you don't have type 2 diabetes and you haven't exercised in 20 years and you're just getting into the gym, yeah, you shouldn't try to run a marathon on day one and try and squat 700 pounds. Like, you got to take things slow and, have a gradual, structured, focused approach. So is that fair to say that the considerations are not so different, and it's more about general considerations for starting an exercise program and not so much about like how the diabetes is going to affect your body in the middle of a workout?
To some degree, yeah. I think it's just that it's more likely that if you have a type 2 diabetes diagnosis, that you will be taking some of the medications that you are at higher risk of cardiovascular complications that you need to take into account. And so I think you do have a bit more caution than that, but
caution because the risk is greater, but the cause would be,
yes.
Yeah, okay, that makes sense.
Probably because it's just very likely that you are at higher risk of different events. Like, you don't want to just suddenly start doing something that you're not used to, and it is also more likely that you are perhaps a little bit more overweight than than would be kind of ideal in that situation.
Right. Now this may be like harsh but true to say, and I think that this is true, and I think this is kind of what we're getting at here without saying it very directly. But like type 2 diabetes is a lifestyle related disease and something that happens to you, and of course there are genetic factors that will make someone more or less likely or more or less likely be predisposed to developing type 2 diabetes. But to some extent, it is because of the choices you have made either on purpose or by accident. And so the reason why you are more likely to be more overweight, have other comorbidities, or just generally less healthy is because of all of these things that have happened. The good news is that most of them are reversible or at least controllable or able to be improved to a much greater degree than someone who is type 1 diabetic, where you can manage that and do your thing and still be great, but you're not going to just get rid of that at any point, right?
Yeah, type 2 diabetes is strongly linked with environment. There's genetic factors that come into play. It's a culmination of the risk of like sitting too much or not doing enough physical activity. These are the things that place you at much higher risk of this. Right. And this is why it's important to incorporate that physical activity as soon as possible. And also, like if you realize you have pre-diabetes in particular, that you start as early as possible to sort of avoid some of these behaviors that are increasing the risk of that. So,
right. Like type 2 diabetes, if we were living in a perfectly functioning society where everyone got the right amount of exercise every day and the perfect nutrition every day and all the social economic factors were quote unquote perfect and all that stuff, like type 2 diabetes probably wouldn't exist at all. And if so, like very, very, very little. Whereas type 1 diabetes is just a unlucky roll of the dice kind of thing, where it's like, the social economic factors don't really matter because that's just how it is, right?
Yeah. I mean, it's largely driven, type 2 diabetes is driven through industrial kind of movement in society towards sedentary behavior, towards an increased level of processed food. You see this as people move from active jobs into offices. That's what drives these things. And you also see this as you see diet changes as well. So with greater access to kind of physical activity, incorporating that, the risk massively decreases.
Right. I think the take home there is that not to like point the finger of blame at anyone who is in this situation, because there's many, many factors, many of which are outside of one's control. But the good news here is that because of because the factors are so closely related to lifestyle and choices that we are able to make, it means that you're able to make choices that can help yourself very much so. And so, you should strive to work on that, because you can help yourself kind of get into a better situation and better health here, right?
Yeah. And I mean, improving any level of your lifestyle in terms of incorporating physical activity, exercise is always going to have a big positive impact in terms of increasing muscle mass, increasing insulin sensitivity, flexibility, cardiovascular health. So it's really, really important to include those aspects, even after being diagnosed with type 2 diabetes.
So what are you doing now with Enhanced that is aiming to help with all this? Like, explain to me kind of what the company does and how it's helping with all this, because all these lifestyle factors and all these things and all the monitoring can be very overwhelming and can be very difficult. We kind of know, I think in general, people like you, smart people, know kind of what needs to be done, but actually implementing it and getting people access to the resources that they need is the tough part. So explain to me like what you guys are doing and how it's going to help.
Yeah, absolutely. I mean, we saw through the experience of working in clinical research, speaking with doctors, people living with diabetes, is that there's so much data nowadays that's generated through the use of continuous glucose monitors, and so many decisions that need to be made on that around how you exercise, how you administer insulin, how you eat, and all of these things to safely exercise. And this kind of need to have the information together to make better decisions was simply lacking. So what we are doing, and what we have done, is created a system which brings together the information from wearables, from exercise wearables that people are increasingly having access to and using, alongside diabetes technologies such as smart insulin pens or insulin pumps that record insulin levels, and continuous glucose monitors, seamlessly putting this data together, so in a way that doesn't require additional work on the part of the person living with this, finding a way to make this data actionable. So the first level was a way to bring this information together, present it to the user. And then the next stage that we're doing now is really looking for ways to guide people on how to take that data to make action behind it and how to exercise safely. So understanding how you respond to a given intensity of exercise so that you can be better informed to exercise safely moving forward. Another key aspect of this is on the doctor's side. So we are really kind of passionate about helping both sides to this. So we have the patient who has to manage this and make all of these decisions every single day. But with doctors, they're only having kind of 15, 20 minutes with each patient every 6 months or so, if they're lucky. And from this, you've got to interpret all of this data from continuous glucose monitors. You've got to rely only on like paper written diaries or memory of the person that's kind of sitting in front of you, and it's difficult to make suggestions, especially around exercise. So what we wanted to do is have a system for the doctors where they can visualize the impact of physical activity, insulin, nutrition on the glucose, so that that conversation is more seamless. We released our mobile app around 3 or 4 weeks ago. We have over 1,000 people using it around the world, so it's not limited by geography. Everyone can download it at the moment. And another key aspect of this is community and education. So as we went through before, like type 1 diabetes upon diagnosis is a condition where you have all of these decisions, and it can feel very, very lonely. And finding other people who have similar experiences, who've also exercised as well, is a powerful way to learn and also kind of feel inspired that it's possible for you to do that. So the app is also a great source of community to find other people living with type 1 diabetes, see what's going on, learn from other people's experiences, and then matching that up with kind of education as well.
Seems like this is one of the real proper intended uses of amalgamation of modern technology, where we have access to so much information around the world, but you might be the only person in your town who has type 1 diabetes. And so there's no one in your, in your school or in your family or in, your immediate circles that can like speak to this experience. And so you're left to just like, well, I gotta see what happens when I eat a banana, and then see what happens when I eat an apple, and see what happens after a bowl of oatmeal. And that might take you 3 years of, guess and check to kind of figure it out. But by communicating with people via the internet and then amalgamating all this data, which has been collected from millions of people over many, many hours and years of time, we can get like, okay, you can cut all that stuff out and like start here, or at least try, these 5 things and then go that way. And this is not that different than any other type of coaching where it's like, okay, I've looked at all of the stuff. You need these 3 options. One of these 3 things is most likely to work for you. Now you still got to do some of your own, I don't want to say research because it's not research, but like, just testing on yourself and see what works. But at least you can kind of narrow out some stuff that is highly unlikely to be beneficial for you, and probably a lot of like myth busting, because I'm sure there's a ton of that. I know even just with the continuous glucose monitors. Like, I'll ask you this actually, if this is fair to say, like, does anyone who is not diabetic need to be wearing those continuous glucose monitors? Is it beneficial in any way other than maybe collecting some fun data for yourself?
So I think there could be some uses for identifying what foods might impact glucose. So like as one example, something that's seen as like a traditionally healthy breakfast might be orange juice with breakfast cereals. But this is going to be something that causes a big kind of spike with blood glucose. If you don't have diabetes, if you're insulin sensitive, your body will respond to that very well. But it's useful to be able to identify that so that you can kind of learn and you can see how those things might further down the line increase your risk of developing type 2 diabetes. The other reason that you might want to use it is for seeing the impact of matching physical activity with nutrition. So the example I just gave with the high sugar breakfast, if you were to go for like a 30-minute walk afterwards, you would probably find that your glucose goes down faster. You reach that normal range faster. The other thing could be that you add some protein or fiber into that meal, and you would notice that the spike in blood glucose is not so pronounced. So I think in those cases where you're interested to sort of experiment with different impacts of nutrition in particular, the impact that physical activity can have around that, I think it could be a useful tool. However, I think that at the moment, it depends on whether you kind of have access to this technology and it's something that you're interested in. But the evidence on a sports performance side is not so strong. I think that mostly just there's not enough evidence. Nobody's looked into where that should be. And you have to remember as well that your body is so good if you don't have diabetes at managing blood glucose itself. There's not that much you can do to manipulate it. If your blood glucose goes higher, you're not administering insulin. You don't need to do that. Your blood glucose will return to a normal level quite quickly because of the insulin that's released anyway. So overall, I think that it could be interesting as a way to kind of experiment and self-learn around specific behaviors. At the moment, given kind of the costs of this technology, and the information about what is really there from a use case, I'm not so sure that I would kind of use it. Whereas like if you have type 1 diabetes, type 2 diabetes, there's very much like an everyday need to have this. And it's very clear that you can have a big impact on it, and it's absolutely kind of essential to monitor, and there's clear evidence that it helps people to use that technology.
Makes perfect sense. If you're not someone who is diabetic, you're not, like, none of the information from wearing a blood glucose monitor is going to be actionable to you. Like you said, you're not administering insulin. You're not really going to like do anything about that other than like, oh, that was interesting. When I had grapes, my blood sugar shot up, and then I went for a walk, and then it came back down, and oh, what do you know? That's exactly a normal response. Like, you know, thumbs up and move on with my day. And so, like, cool to know, I guess, but like not really, not changing your life or your actions per se. And in some depending on the country and the system and the whatever, like maybe even taking away some of that access to technology from other people based on supply chains and whatnot as well.
Yeah, I mean, I don't know too much about like the kind of access and stuff like that. However, I would say that like the more people who have an interest into it, I would assume that it will increase the rate that kind of R&D goes into developing the technology, the speed at which this technology decreases in price. So maybe it could have a positive impact for everybody further down the line. But I agree with you completely that in the short term, in the immediate term, it's not something that I would go for.
The thing that I've seen with it that brings a slight negative towards using it, again, for non-diabetics, is that people associate a spike in blood glucose with bad. And it's like, well, I'm normally healthy and, I have an orange and my blood glucose goes up. Well, that's a normal response. And then it comes down normally. And so the association that people make without doing, enough homework and critical thinking about this is that, well, if oranges make my blood glucose go up, then oranges must be bad. And so oranges are bad, and so all fruits are bad, and all carbohydrates are quote unquote bad for me and make me fat and make me whatever, which we know that that's just not true. If your blood glucose is not coming back down, like that's an issue. If your blood glucose is always spiked and never returning and it's always highly, highly elevated, then yes, that's a problem. But like eating a food that spikes your blood glucose for a very short period of time is the normal response, and that is like totally healthy and totally okay. And please correct me if I'm wrong in saying any of that.
I think it just depends really on the individual, and it's about moderation and not overdoing it and stuff like that. Like it depends on where you are and what level of activity you're doing, what your diet is normally like, but obviously limiting too much of this kind of like high sugar foods is surely good for the majority of people, but I wouldn't overstress it.
Yeah, fair enough. Any other considerations that people should know? Anything that we missed in regards to either type 1 or type 2 diabetes? I mean, I'm sure you can talk about this for hours. Obviously, this is your life, but any of the like big blocks that we missed?
Yeah, there's a lot. I mean, there's a lot of different topics, but not too much that I can think of to specifically. Okay. Bring
anything? What can people expect upcoming with the app, and they can find it on Apple, Android app stores, like anything to expect? I know that it just came out, but anything to expect coming up in the next couple of weeks or months?
Yeah, so with the app enhanced, so we're working hard to improve the quality and the features of it. Obviously, we should have a new build coming out, I think, on Monday, which now has the ability to bring in the carbohydrate data and some insulin data. So this makes it much more complete from that point of view. If anybody's using the app, they'll understand what I mean in terms of being able to like bring that information in. Moving forward over the next couple of weeks, we have some aspects where we're starting to use the data to generate kind of text-based suggestions around your exercise, summarizing different things, using different types of AI to really kind of understand your data and provide suggestions. Other features that will start coming will be around organizing specific types of exercise events into groups so you can see the trends. So something that's a particular kind of challenge for people is remembering how blood glucose responded in different types of exercise, or seeing that so they can plan for the future. But if the app is able to group, for example, bike rides of a certain intensity, when you took your dog for a walk, when you did yoga, when you went for a swim, it can help you to better plan moving forward nutrition, insulin around that. So that's what that's what we're working on at the moment. Yeah.
Very cool. Very cool. I'm always a big proponent of, just in general with health and fitness, like the first thing we got to do is get clear. Like, let's track like what you're actually doing, and let's track the response to that. Like, you think you're eating X, and you say that you eat no cookies, but like, let's track your food, and like, oh, you do have a couple cookies, and that's not bad. We just gotta like, let's just understand the outcomes of this and manage it, right? And same with exercise. You say you go to the gym 6 hours a week. When we track it, turns out it's 3 hours a week. And again, that's not bad. It is what it is, and we got to deal with it accordingly. So I'm a big, huge fan of just like getting some data, and then what do we actually do with this data? And so I'm in one way, I'm shocked that like something like this and a good system for this doesn't exist in the diabetic population and in that market. But on the other hand, I'm very happy that you guys are doing it in a good way that will be undoubtedly extremely beneficial for millions of people around the world.
I hope so. I mean, the whole kind of project is driven around, we're very kind of passionate around helping people in this area. And we saw that unless we dedicated 100% of our time, it just wasn't going to happen. We didn't see other people going in this direction to really create something that provided action around glucose monitoring technology in the context of exercise. It's something that is really impressive to see already on the app. As I say, we have over 1,000 people doing it, and it's great to see. There's a feature of the app where you can see different people's kind of exercise, what they're achieving, and you're seeing all kinds of things from people achieving like 5-hour bike rides, climbing mountains. There's somebody I was speaking today who wants to use it to track they're climbing like 7 mountains or something like that. We're also working with people who are really at the beginning of their exercise journey to help them start that. And the more that we can kind of help people to see that the barriers are less and then overcome them, that makes us like really happy, and we want to continue with it.
Very cool. I'm very excited for it as well. And just for what it's worth, we're recording this like mid-December, and this episode will be out in January sometime. So some of the updates that you mentioned will already be or should already be out by the time this episode is up, which is great. Sam, is there anything else that you wanna leave the people with here before we close? Any other closing thoughts?
Oh, you've put me on the spot. I don't know. I mean, other than the fact that, if people do have questions, around like type 1 diabetes in particular, if they think that there's some way in which, I might be able to help, or some of the team could help, please get in touch. We always want to, have a conversation, always, wanting to build what we're doing with real users in mind, to take on feedback. But like my email inbox is open for people to get in touch. Maybe there's things which are different from individuals, that like maybe I've said something that doesn't completely apply to everybody. So I think it's to say that if you're interested in finding more, please get in touch.
For sure. I'll throw the contact info in the show notes so people can easily find it. But the website is enhanced.com/app, and enhanced is enhanced-d. But easy enough to find, so I'll throw it in the show notes. Sam, thank you very much for your time. I very much appreciate it. I learned a lot. I'm sure it's going to help lots of people, and I hope that people who need this will use the app and help themselves and help the entire community, because everyone's going to help each other with this. So I appreciate you very much. Guys, check out the Enhanced app. Make sure you're followed and subscribe to them, and share this with people in your life who that would help them, because not obviously, but I think that we all know someone or close within a couple degrees who would need something like this. So send it out there and help them help themselves. But sharing this episode is probably the best way to get that out there. So like, share, subscribe, all those fun stuff to help good information get out there. We appreciate each and every one of you for listening. As always, go outside, be a good person. See you next time.